You are watching the Doctalk show.
The National Drug Authority is a government entity that ensures that all drugs or medicines within the country that are available for public consumption are regulated, tested, and of a certain acceptable level of quality. What should you do if the pharmacy where you're buying the drugs from sells to you drugs that are labeled not for sale, property of the government of Uganda? Our guest in the studio from the NDA are here to tell us more about what you can do in such a scenario. So I don't know who would want to answer that. Maybe Dr. William.
Yes.
What can a patient do if they are faced with such a situation?
Maybe one thing is for the public to know is that once you see any medication labeled Government of Uganda, not for sale, just know that that product should only be issued by a public facility. What's a public facility? These are government-owned facilities. Hospitals, health centers, government-owned facilities. And these products are not for sale. They are issued free to patients in public health facilities. In the event, that's why it's important to check the products that you buy from pharmacies or drug shops. In the event you are sold a product, usually if it's a blister pack like this, you'll even find the blisters have that mark. Even the primary pack usually has that mark. In case there are syrups or so, you'll find a mark round, yeah, both on the primary pack. It's always there. Yes, Government of Uganda, not for sale. For somewhere maybe space is a constraint, they'll have a UG or something like that. You will know that this is government, ideally, property. Yes. Once you realize this, that should be an alarm, an alert. You need to notify National Drug Authority immediately, because it will mean that there are people who are either siphoning these products from the health facilities and are having them resold. So please, the public ought to know that this is a crime.
Fastest approach, run to the police. Tell them I picked this from the other shop. Like I said, NDA works as a team, work with different agencies, and one of the agencies we work with is police. So when you form police can easily get to NDA and they'll come and work out something.
Okay, so moving on, another final topic as we conclude this discussion is the issue of self-prescriptions. People walk to the pharmacy and say they want this drug X or Y. You know very well it's a class A or B, because you say those are the drugs which need a prescription from a doctor. So what are the dangers of someone buying their drugs without the consultation of the doctor? What they call self-prescription.
You're putting yourself at a risk of poisoning yourself to a level of death or disability. You can actually lose something, or you can get yourself disabled or even kill yourself with these medicines. Simple as they are, they can actually kill. One of the commonest medicines people pick is the yellow and red capsule. I'll keep it at that, as a yellow and red capsule, but ideally it's an antibiotic called amoxicillin. Now, this may seem so simple. I see so many people go and ask for it anywhere. But for some people, even those in Uganda, that product falls into a category of products called penicillins. There are particular people in Uganda who are not able to have those products in their bodies. Their bodies do not accept such products.
They're allergic to those
penicillins.
drugs.
Now, you go and pick it for yourself, and you take it in, and what you get may not be really, really good for you. I mean, maybe that bad for you. So simple as these medicines may look, they are very, very serious poison. So I request the public, please desist from this activity, desist from picking medicines and taking, I mean, so-and-so's child used it, I can also use it. No, your child is different, the other person's child is different. Let someone recommend something for you.
By a doctor. And in addition, it also promotes, in the medical field, what we call drug resistance.
And currently, the problem of resistance is running so high in our country, and we are going to be faced with a problem of where we have no products that can help us even in the simplest of conditions. That's how resistance is becoming a problem worldwide. We are all just having taking medicines without controlling them. So we're going to reach a point where you can't even treat the simplest of infections because the products cannot work.
And that's mainly because someone overused the medicine in the past, usually without the consultation of a doctor. So there's another issue which we didn't also highlight. There are concerns that people are using human medicine in animal rearing. So they're rearing chicken, they're rearing animals, goats or cows. But they're using medicines to fatten or to improve the quality of the animals. Does the NDA play a role in regulating or restricting this process? Because it seems to be an illegal, very scary process. We see it in the news, but we don't know who is in charge of controlling that.
Maybe what we need to know that one, National Drug Authority regulates medicines, and by medicine that's broad. That's both human and veterinary medicines.
Animal medicine.
Animal, yes. Veterinary is animal, animal medicines. Now, what people need to know is that there's this concept of One Health. Now, One Health means that what you do in the veterinary side can have an impact on the human side. Many people take milk, many people eat beef, many people eat chicken. Now, if medications are used in the animal field are not handled well, and at the end of the day, it's a cycle. So that aspect of One Health tends to look at the whole concept of medicine use throughout even the food chain, because at times resistance because you know that penicillins, for example, are used both in animal and in veterinary medicines. There are other kinds of medicine that are used in both, I would say both worlds, both the human and the animal world. So if this is not controlled, it creates a challenge. Aspects of resistance, and at the end of the day, the cost of managing disease, treating disease is going to shoot up. Because if the simple medicines cannot work, you have to go to better molecules, which are more expensive. And if you live in a poverty-stricken country whereby the disposable incomes are pretty low, then you find that many people actually will not be able to afford the healthcare.
So does NDA do checks on the animal products, for example?
Ideally,
make sure they don't have drug levels.
Now, okay, that's, I would say, a discussion for another day, how that is, and I think and that will need to also get a veterinary surgeon in so that people appreciate what happens in the veterinary world that can have an impact on the human, yes, so that people stop taking things for granted.
Okay.
Yes, I'll give us a simple, this is a communication to the professionals out there. I know the medicines that people are using currently in the veterinary products for fattening purposes. And the question is, how does people access these medicines? So that is the practice bit. If a farmer came to you and told you, give me this amount of products, really you need to be careful and know why is he taking them. The kind of products these people use are not products that are readily available on the market. So question is, where do they get them? So you, the health worker who is giving out these products, you know exactly where they're going to use them. So it's an issue of ethical practice. And then we need to know that these products, when they go into the body, they don't just come out. So when this product is in the animal tissue, and we, the people, other people on the other side consume, we're actually consuming that product as it is in the animal tissue. There's what they call withdrawal period in animals. I mean, the animal takes in the product, after what amount of time does this product completely wipe out into the animal? But now, because we are throwing in these human products into the animals, we don't even know their withdrawal period in these animals. So what do? We have these products raw and we take them into our bodies with those products. So what are we creating? Resistance and uncalled for things that, I mean, like diseases, cancers of this world, coming through because of someone's unethical practice. So this is an issue of practice. I know it goes into the medicines, and NDA is doing a good job on that. We shall, like we said, we shall discuss. There's a team that's working on that. But as the professionals out there, ensure that the people you're giving these medicines, especially the vets, they're going to use it for the reason for which they bought them.
Okay. So I want to thank our guests in the studio from the NDA Regulatory Authority for giving us this information regarding drugs and the qualities in the market. So you've heard it from the horse's mouth. Always ensure you always check the drug packages, make sure the drugs are not expired, keep them in proper storage conditions, and if they are expired while at home, the best thing is to take it to the pharmacy where you bought it from so that they can properly dispose of these drugs. Take care of the products you buy, the eggs or the meats or the chickens. Ensure that the animals were not reared using medicinal products, because this can be harmful to your health. So we'll see you next time on the Doctalk show. You can send in your questions and comments on our social media platforms. Always happy to hear from you. From us at the Doctalk show studio, have a good night.